Hello and welcome to the program. Health Matters, and I am Mary Alale Yusuf. Eating disorders have been reported to be uncommon among Western populations, yet some experts believe that they do not discriminate, but affect all cultures, genders, socioeconomic groups, and ages, and that the frequency of its presentation has increased worldwide. According to some experts, they may present differently in different cultures. What is known is that they have the greatest morbidity and mortality of all disorders of their kind. The statistics for eating disorders in sub-Saharan Africa are sketchy at best because of the incredulity attached to it. But to throw more light on this matter is Dr. Olatunji Aino. Dr. Aino is an associate professor and consultant psychiatrist, College of Medicine, University of Lagos, and Lagos University Teaching Hospital, Idi-Araba. You're welcome to the program, Dr. Aino.
Thank you very much, presenter.
Let's start with asking, what is an eating disorder? Sounds strange here.
Good afternoon, viewers. Eating disorders, they are sort of psychological problems in which there is distortion of the body image in the individual. And again, there's pathological desire for thinness and actions being carried out to lose weight. So these are the constituents of the definition of eating disorders.
You say distortion of the image. Does it mean that the person now sees himself or herself different from what they really are?
Exactly. The individual sees himself or herself as being over-bloated or overweight, when in actual fact, even he or she may be underweight.
Okay. And do we have just one type of eating disorder, just the desire to be thin and that's all?
Now, there are varieties of eating disorders. The common ones include the following: anorexia disorder, or what some people classify as anorexia nervosa. Then we have the bulimia nervosa. Then we have the binge eating disorder.
Okay.
And the fourth one is eating disorder not classified.
Classified. Okay. Now, can you describe the differences between these different disorders? How do they, they are classified, so there must be something different about each of them. What are these differences?
Well, for the anorexia nervosa, here the individual starves herself, because it's very common among the females compared with the males.
Okay.
Then again is underweight, grossly underweight, and the individual carries out actions to even lose the weight again. For instance, using laxatives, induction of vomiting, excessive exercise, just to keep thin.
Okay.
But unlike anorexia nervosa, in bulimia nervosa, sometimes the individual involves in binge eating, and afterward now engages in actions to shed the excessive weight.
When you say binge, does that mean sporadic? All of a sudden there's a craving to eat?
Exactly. Okay. And sometimes in bulimia nervosa, they may have normal weight or even be overweight, but they engage in binge eating, and afterward they carry out actions in order to shed excessive weight they might have gained. Like, for instance, induction of vomiting, the use of laxatives just to empty their bowel recurrently,
only to go and eat more.
Exactly. That, of course.
And how about the binge eating disorder? There's that one you mentioned.
That one, they engage in perpetual excessive consumption of food
without trying to induce vomiting or lose the weight at all.
The weight.
Okay, such a person is bound to be fat.
He is bound to be fat, exactly.
All right.
Okay.
You have already said that this is caused by psychiatric problems. This is really shocking. So, the average girl these days, the average girl wants to be slim, and does carry out some actions, in that line, like dieting, exercise. Should we be concerned? Is that a problem? When does it cross over from just a normal desire to be an ideal weight to a psychiatric problem?
Well, just to correct the point you made, the cause is not just restricted to psychiatric disorders.
Okay.
There are multifactorial causes of eating disorders. It cuts across what I can classify as biological factors, psychological factors, as well as social factors. Okay. In biological factors, we know that eating disorder can run in some families, in which case it is genetic, it can be inherited, or they can be inherited, because there are many types of eating disorders.
Someone can inherit anorexia nervosa?
It can be genetic. Can be genetic. That's one of the biological factors.
That's the classification there: genetic, social, psychological.
Psychological.
They all come together
they all come together to cause this eating disorder in individuals.
Okay.
Then the other biological factor includes some brain chemicals, which in medical parlance we call neurotransmitters. Distortion in some of these brain chemicals can tip the individual to develop eating disorders. I won't bother the audience by mentioning most of terminologies that may not be well understood, but just understand that brain chemicals, which you call neurotransmitters, distortion in some of them can cause eating disorders. Then in terms of psychological causative factors, as I mentioned earlier on, the distortion in perception of the body image in the individual can be a causative factor of eating disorders. Then again, we also know that certain traumatic events in the past, especially things like physical or sexual abuse, can tip the individual to develop eating disorders.
Why would in terms of social abuse be a cause? What's the link between physical abuse and food?
Well, in the physical abuse or sexual abuse, we know some of the victims can develop what we call post-traumatic stress disorder in psychiatry. It's a complication of a traumatic event. And you know, a non-consensual sexual intercourse is a traumatic event.
Yes.
So some of these victims can develop that psychiatric complication of post-traumatic stress disorder, and it's been known in various research studies that eating disorders can be a manifestation of such psychological complication of the traumatic event.
Now, I'm sure some of our viewers are asking, why are they discussing this? This doesn't happen to Africans, doesn't happen to Nigerians. We don't have enough food. We don't have, food to throw away and vomit up. But does this happen in this country?
Well, to some extent, those with that belief, may not necessarily be wrong anyway, because eating disorders can only be diagnosed when foods are present.
Okay.
It's not a situation caused by poverty. There's presence of food, but the individual is not just taking the food anyway. And again, before the diagnosis of eating disorder must be made, certain other factors that can cause thinness or weight loss must be ruled out by, like certain medical problems, medication, and so on and so forth. Well, the belief, especially for many years, is that eating disorders do not necessarily exist in this part of the world. But we now know that a combination of two factors is making people to be aware that this thing may exist with us. This includes increasing westernization, and studies have shown that westernization brings about things like eating disorder, and again the awareness in the public. So these two factors may be adduced to reasons for the.
So are you saying that, I'm looking at the awareness bit now.
Yeah.
Are you saying that people are becoming aware of what has already existed in the society? They're beginning to see it for the first time. Is that what you're saying?
Well, as I did mention earlier on, that it's been shown that westernization tend to increase the risk of susceptibility to eating disorders.
Okay.
So these things have been in existence, but there is increasing awareness now. Over the past few decades, more Nigerians travel overseas, especially to the Western countries, and they are aware that these things do exist. And again, coming back home, because of this awareness, they may be on the lookout for this problem, and also with the increasing level of westernization, socialization in this part of the world. And mark you, some clinicians or researchers have shown that even the media they are not helping matters, because the media tend to promote things like beauty pageants, advertisements over the media about necessity to keep certain statistics of body weight and body build. All this, they tend to increase the adolescent susceptibility to developing eating disorders, because they want to, have a